When we breathe, air filled with oxygen flows down through our airways into the lungs. Sometimes the air we breathe can be filled with hazardous material, such as the smoke from a fire. When these materials enter the airways, they can cause serious damage to the lungs. Fortunately, our lungs have a special defense mechanism. If we take a closer look, we can see that the airways consist of small detectors. When these detectors smell the scent of danger, they will be triggered and activate the defense mechanism. The muscles around the airways will tighten, which prevents the hazardous material from entering further into the lungs. There are people, however, that experience the defense mechanism very often, even if they are only petting a harmless dog. This is often the cause of asthma. People with asthma have a chronic inflammation in their lungs, which means that their detectors are confused and trigger the defense mechanism unnecessarily often, therefore blocking a majority of the incoming air. Fortunately, there is a medicine called the Turbuscope. Although it doesn't cure asthma, it can help to reduce the inflammation and therefore reducing the trigger response of the detectors. The downside of this medication is that it takes several weeks before it takes effect. Therefore, the patient could think that the medication is not properly working, which results in poor adherence to the medication. To help the patients to manage their asthma, we introduce the Turbuscope. The Turbuscope is a smart sensor system that automatically tracks medication adherence and the asthma state and presents these values in a way that it creates awareness about the medication. Once someone is diagnosed with asthma, they can choose to receive the product and take it home. The product consists of several different elements. First, there is the Turbu Plus, a more advanced version of the Turbuhaler. It automatically tracks medication usage and sends this data through Bluetooth to a smartphone device. Then there is the sensor, which works as a digital stethoscope. It can be integrated in a comfortable, non-invasive neck brace to allow effortless tracking. It will be worn during the night and is able to detect coughing and wheezing sounds, after which it will be sent to the smartphone. Finally, there's the smartphone that collects all the data and visualizes it in a clear way. It can show the progression the patient has made on the inflammation. Next, there is the sensor data, which is visualized as blue arrows indicating the air that is able to pass through. And finally, there is the holistic view, in which the patients can check the data of the arrows and the detectors in an integrated and holistic picture. After several weeks, the patient returns for a second consult. During this consult, the patient and the doctor reflect on the data and the progression that was made. The patient will see that the use of the medication helps to improve their asthma over the longer term, and will therefore be more motivated to use it every day.